I'm here with Jim Horn, who is a current member of the Palm Drive Healthcare District Board and is running for re-election. Welcome, Jim.
Thank you.
So you're on the board and you're up for re-election. And first, maybe we could start off with some of your background. Who are you and how'd you get here?
Okay. I've been on the board since July. I was appointed to fill a vacancy. The former president of the board resigned. So I got on the board in July, and by early August I had to decide if I wanted to run for re-election. And my wife told me she's a former nurse, and she said, I really think you should be on that board, and I agree. So I'm an engineer by training. I went to Caltech, have had my own business for about 28 years. And during that time, I've done a lot of healthcare projects. I've done projects at Sutter and Kaiser and Memorial and various hospitals around. So I do know kind of the ins and outs of hospital regulation. It's very complicated. And one of the problems Palm Drive has had is that the same regulations apply to small hospitals as to very large hospitals. But the smaller you are, the harder it is to comply. I've also been on the school board at Gravenstein School District for the last 12 years. I was board president for 7 years. And so I'm very familiar with how public agencies do their budgeting, how the Brown Act works for public bodies. I'm used to reading our budgets and financial sheets and so forth. Our school district, before I got on the board, had declining enrollment for about 10 years straight. Since I've been on the board, we've increased enrollment by about 40%. We're one of the few districts actually in Sonoma County that has. And it's been through really watching our money and creating some innovative programs to attract people. And that's kind of, what we're looking at for a hospital or some other sort of healthcare thing here. Also, I mentioned my wife. She was a nurse at Palm Drive for 6 years in the medical surgical unit. So I've certainly heard a lot of stories and know a lot of how the hospital works from the internal standpoint that I think even doctors and certainly board members don't see. And so she urged me to run 4 years ago, which I did, and I lost, which was probably good because I wasn't on the board when they closed down and went into bankruptcy this spring. But I am hoping that I can help get us out of bankruptcy, which is a huge challenge, and restore the best health services we can to the most people. And that includes people up on the river who really haven't gotten much bang for their buck out of their parcel taxes, out at the coast, and then people closer to the center of the world here in Sebastopol.
Why should people vote for you and not the Doc and the Cop, as it's called?
The Doc and the Cop.
Uh-huh.
Well, I think I have a lot more experience in being on a board, and being on a board. Somebody once told me that the best boards are ones where nobody actually knows the names of anybody because you're not in the press, you don't have big headlines. People just kind of do their jobs, they get along, they work collegially, they do their homework, they look at their board packets, they look at their financial statements. They really just kind of do the nitty-gritty of governing an institution, in this case a healthcare district. This district is really large too, but most people don't realize it's almost 300 square miles. It goes, and my house is about 4 miles south of here, and I'm kind of on the south edge, but this district goes up past Guerneville, past Jenner. It's a huge district, and it's a big responsibility. I think my engineering background helps me really analyze the financial situation. And Palm Drive's problem wasn't that it couldn't give great care. We were one of the highest rated hospitals in the country in a recent survey just before they closed. And I know from talking with my wife, and I know a lot of her friends who were nurses there, they did fantastic care. The problem was being able to do it without losing money. And so I think I'm a good choice for that as well.
So the Doc and the Cop, that's Dr. Richard Powers and Dennis Colhurst. They appear to be in full support of the Palm Drive Healthcare Foundation's plan to reopen the hospital. But I take it that you're not fully there yet.
Yeah, Dennis Colhurst is the treasurer of the foundation, and Dr. Powers is a board member, and he was um, the chair, I guess you would call him, of the Open Our Hospital campaign. So they're intimately involved with that plan. I'm on a committee with the board that's tasked with reviewing the proposal from the foundation. We got that proposal back in late August, and even as of today, we still haven't gotten financial data that we need to really analyze the program. Because again, it's not the problem with the hospital wasn't giving great care to people; it was how to do it without losing money. The hospital has had an operating loss every year that it's been open. In the last 13 years, it's lost about $64 million in operating losses. I know some people dispute that, but that's based on state regulators' published data, so that's a fact. And so until we see that information, it's impossible, in my mind, to really make a final judgment on that thing, on that plan. And one thing a lot of people don't realize is that this district's in bankruptcy for the second time. The bankruptcy judge has stopped calling it a Chapter 9. He's calling it a Chapter 18 at this point. And hopefully we're not going to go down to Chapter 27. But whatever plan the district and the foundation agree upon, we have to sell that to the bankruptcy court, to the judge and the creditors. And right now, the district is in debt to creditors for about $9.5 million. And we have maybe $1 million in cash to cover that. Now, those creditors include our own employees who are owed paid time off and essentially a severance payment that's required based on the size of the hospital. We owe them about $1.3 million. And the rest we owe to vendors who are big and small, some small local businesses, some huge corporations. GE Corporation's one of our creditors. Dr. Powers is a creditor, because he's the head of a group called the West County Emergency Services Group, which has provided the emergency room doctors for quite a few years. And so I think their contract was something like $1.3 million a year. They're owed money by the hospital because the hospital wasn't able to pay their final bills either. So I don't think any bankruptcy court, and I don't think the creditors committees that we have to deal with, are going to let us pay them 10 cents on the dollar or 11 cents on the dollar. The last bankruptcy they got out of, they paid the smaller creditors about 70 cents on the dollar and the bigger ones about 50 cents on the dollar. But the way they did that was by borrowing an additional $11 million at over 7% interest. And that was when bond rates and interest rates were at historically low levels. So it was a horrible deal for the district. But it was a horrible deal because we were in bankruptcy and we had a junk bond rating. We still have the same junk bond rating. So the ability to really be convinced that that financial plan that the foundation has put out is going to work has a reasonable chance of success. As a board member, I have to convince myself that that's true. And then really the tough part comes, which is convincing the bankruptcy judge and those creditors that we owe $9.5 million to, that plan is going to work as well.
Huh. So if you see the numbers and you think it can work, you would support the plan?
Yes.
Okay, great. Do you have any other concerns about the plan you want to go into?
One thing in evaluating the finances is trying to figure out what's going to be different about this plan from what we've done in the past. This plan has a big emphasis on creating what they call institutes. There's an orthopedics institute, a neurology institute, a neurosurgery institute, urology institute. But what I've noticed is that a lot of these institutes are run by doctors who've been providing services at the hospital for a long time. For example, the Orthopedics Institute, we've had a group called Sebastopol Orthopedics, Dr. Bollinger, Dr. Bragonier, and they've been doing most of their surgeries at the hospital for years and years. Now the foundation plan is to have the Bollinger Institute of Orthopedics and Sports Medicine. But I talked to Dr. Bollinger, whose kids go to my school district, and he said, really, there's not that much different in what they'll be doing as an institute from what they were doing before. He says there's a marketing emphasis, and he says institutes sound sexier, but really they'll be doing kind of the same things they've been doing before. I haven't gotten into detail with some of the other ones, but I'm just concerned that there's an emphasis on marketing, which is great, but if that's all it is just rebranding, remarketing what we've done in the past, I'm not sure why we're going to expect different results.
So I guess that's what it comes down to. Your concern is that the plan won't generate the financial aspect of the plan won't work out as they hope, and it's in the end it's not going to be all that different.
That's what it appears to me, but you know, I'm still open. Our committee sent the foundation a list of about 17 or 18 questions a couple of weeks ago. We'd asked if they could meet with us this Friday to kind of go over the list informally, and they said no. We'd asked if we could get the financial data this week, and they said it's not ready yet. So we're still kind of waiting.
All right. So if the hospital doesn't reopen, what's another path? What happens then?
Well, I'd say that probably the idea that makes the most sense is to open up some sort of an urgent care center in that building. I mean, that building's set up to do medicine, and it's what would be a waste if we don't do that in that building. There's all kinds of urgent care. Urgent care can be essentially just a doctor staying open late and taking walk-in patients. But you can also have an urgent care that you can do IVs, you can have your radiology department do x-rays, you have your laboratory open. So it's kind of like an enhanced urgent care. We had gotten the proposal from Memorial Hospital to open an urgent care center, but just not in that building. I think they're waiting to see if we can work out a deal to open the hospital there. If we can't, if it doesn't look like that's going to work out, I think we definitely go back to Memorial and say, assuming you're going into our building, since we've got this building and it's set up, what would your proposal look like at that point? I've heard proposals of taking the existing operating rooms and essentially starting an outpatient surgery center. One problem, let me back up. One problem we've got is that in California, you can't have a standalone emergency room unless you're really far from any other healthcare service. I think there's one way up the coast somewhere, for example. But in our case, when we're 10, 12 miles away from 3 major hospitals, there's no way the state's going to let us do that. To have an emergency room, we have to have a full acute care hospital as well. And that's where the economics get really dicey. We can open up an urgent care center, though. We can have an outpatient surgery center. We can have labs and radiologies so that local doctors can refer their patients and get tests done, get x-rays done, and so forth. I've heard some discussion about opening up, leasing other space to, alternative medicine people, acupuncture, all kinds of things that are possibilities that you could do with that building. That whole process would be certainly less expensive than running a hospital, less regulated, and more chance of, I think, long-term success if we can't find our way to opening the hospital itself.
Okay, and then how do you address the needs for the people by the river and the coast?
I think from what our committee has seen, one of the big needs right now is at least one more ambulance, full-time advanced life support ambulance that's able to service the coast and the river areas. Right now, because of the scheduling, when one ambulance comes in on call and goes to either Palm Drive or into Santa Rosa, you have a gap out there. And the ambulance services, the Russian River Fire Department, Bodega Bay Fire Department, there's a private company that kind of services the center area. They all try to help out and shift resources around. But we're being told that there are times when they just flat out run out of ambulances. They're expensive. They're about $250,000 a piece, plus a crew to EMTs and a crew to staff them. So it's expensive, but it's exactly the kind of thing that our healthcare district could be doing to help people. I've talked to Mary Seychet, who's heads she's executive director of the West County Health Centers, and she would love to see some sort of urgent care center in Guerneville. She said, especially during the summertime when you have a heavier tourist load. I think a lot of people along the river and to the coast to some extent feel like they really haven't gotten any bang for their buck from their parcel taxes. I've heard an estimate, I haven't verified it, But I've heard an estimate that the three sort of northernmost school districts, Guerneville, Monterey, and Forestville, actually pay 42% of the parcel taxes just because of the number of parcels they have. Clearly, they haven't been getting the services that we get closer to Sebastopol. And when Sutter Hospital opens up at the end of River Road and Highway 101, I think a lot of those people feel like they'll just go to Sutter. You know, that it's closer, it's faster, and it may not be, you know, as personal as Palm Drive was, but it's not clear that Palm Drive can be as personal as it was and still make money.
Okay, well, thanks for taking time to let us know where you are on all this, and good luck in the election.
Thank you very much.
All right, bye-bye, Jim.